Welcome back. As we dive into the topic of whole being health, don't forget we're here at ChiroThon in New Jersey with the goal of raising $75,000 to raise awareness about the importance of chiropractic care. Now, to make that donation, you can visit f4cp.org/Chirothon. And if you're a doctor of chiropractic and you donate $180 or more today, you will receive a complimentary 1-year membership with the Foundation for Chiropractic Progress. So don't wait, do it now. Now, this vignette is sponsored by Stop Pain Clinical. Stop Pain Clinical is a highly effective topical pain relief alternative to NSAIDs and opioids. Its uniquely powerful formula with 10% menthol and glucosamine is only available from clinics. Google Stop Pain Clinical Locator to find Stop Pain and a chiropractor near you.
Well, this past year, the foundation produced 5 commercials that aired 350 times during the National Finals Rodeo in Las Vegas in December. These commercials focus on healthcare for rodeo athletes and how chiropractic care relieves pain, enhances riding techniques, and performance. Take a look.
If I didn't have a team of expert doctors taking care of me, this wouldn't allow me to perform at my very best. Here at the world-famous Calgary Stampede, we have healthcare experts from many disciplines, including chiropractic. Every provider is here because they are an integral part of the care our athletes require to compete at the highest level. No matter what you do in life, make sure you have a complete healthcare team that includes a chiropractor. You need one just as much as I do. Go to f4cp.org/find-a-doctor to find a chiropractor near you.
We're very excited to welcome our special guest speaker, Dr. Tara Chalakani. Dr. Tara is an integrative psychotherapist with over 30 years of experience in healthcare. She combines clinical insight with a holistic, trauma-informed approach to help clients heal, grow, and become their best selves. Known for her warmth and compassion, Dr. Tara creates a safe space for deep personal transformation. She serves as an assistant professor at Hackensack Meridian Medical School at John Keane University and speaks around the country about mind-body connection. Thank you so much for joining us today.
It's my pleasure.
Excited. Well, I think one of the big keys is, and having spoke to you, is chiropractic is kind of part of your ethos. It's being able to develop who you are and have that transformative impact. So we're grateful, and we know our audience, those that are out there that are listening, are really excited to hear what you have to say because you're an expert in this field, and I know that you've seen a lot of transformation in many of the patients that you see. But one of the pieces that I think is inspirational is knowing where someone comes from and where they want to go. So what inspired you to dedicate your career to mental health and whole being care?
Well, it didn't happen intentionally, but I can tell you that it did happen because of my own experiences and my own commitment to my whole body health. I was introduced to chiropractic at the age of 16, and it's been a part of my life ever since. And I know what the benefits are. And I also know that especially when we're looking at the whole person, there's no distinction between mental and physical. There's one health, one body. And when I work with my clients, chiropractic referrals are part of my repertoire, in addition to nutrition, movement, spirituality, because it's never one thing. There's not one path to wellness. It's a whole collection of practices.
Well, you know, what are some of the key things that people should know about the connection between emotional well-being and physical well-being? And how do they impact or influence our mental health?
Well, the most important thing to consider is the power our emotions have on our physical being. And as providers, it's our duty to really look at the big picture. And when someone is complaining of a persistent pain or pain that won't be relieved, we really need to take a deeper dig and look to what's going on in their life, what's happened to them, because trauma is something that no one escapes. It's 7 out of 10 adults have experienced a significant trauma in their lives, and our body holds it. We hold dis-ease in our bodies. So we really need to be willing to have conversations that maybe can be uncomfortable for a provider who isn't typically trained in talking about emotional matters, but we don't grow unless we get a little uncomfortable. So to grow as a provider, we need to get comfortable with that.
I think that's one of the key aspects is in your role being a doctor treating patients, you often have to ensure that the doctors in your community are very much aware of how to have those conversations. So for you, in your experience, how do you open these difficult conversations, especially with the doctors that are listening right now, or other healthcare professionals that I know you're out there because I invited you personally to ChiroThon? How do you play a role in supporting that mental health aspect?
Well, I think it starts granular and grows. You know, it's hard when someone has been trained a specific way to change the way that they practice, but I think the more we work with our patients, and I work with my clients, that they go out into the world and they talk to someone and they talk to their other providers and bring awareness to the fact that, you know, hey, I'm feeling better because I'm in psychotherapy, or I'm feeling better because I'm seeing a chiropractor. And it creates an awareness that maybe the medical community will embrace us a little bit more. But I always say we have to kind of start small and spread that message outwards.
Well, you know, I love the collaboration that we're having in healthcare, because I truly believe that that's what's going to allow our society to be the healthiest that it can be. But we also know that we live unprecedented times. People are very overwhelmed right now with stress. How would you say are some of the best ways that people can integrate some maybe daily routines or something that will help them maybe potentially deal better with their mental health issues?
Sure. And again, I think it's a similar mindset to start small. I think a lot of people, they get inspired to be healthier, but they take on too big of a project, right? The exercise routine they want to subscribe to is too much too fast, or a way of eating, you know, juicing when they didn't typically do it. So I think we have to be gentle with ourselves. We have to be kind and start small. You know, like maybe today I'll walk around the block and then build up, instead of, you know, I'm going to start running 5 miles a day. And I think a lot of people find spiritual practices daunting, like they have to join a yoga studio or something, but meditation is 5 minutes alone with yourself in your own home. It doesn't have to be something monumental or grandiose. Any little bit helps.
I like that you said any little bit helps, because so much of our audience really, they hear something and then they want to implement, like, I got to do this right away and I got to do it really well. Like there's a lot of pressure in many people's lives to be perfect.
Yes.
And I always remember it's better to get it done than to be perfect, because sometimes it's that almost like you stop because you know how much work it's going to be, and then you just put it off. You procrastinate, which is a really unfortunate piece, because then it's starting to add to your anxiety and your worry, potentially depression, and then I need to see Dr. Tara. How do I help myself?
Exactly. And one of the things that I'm very fascinated with is longevity, and understanding the habits of people who do live to be 100 or close to it and still remain active. And the one thing that I hear over and over again is they've never had a prescriptive exercise routine or a prescriptive diet. They organically move. It's very just part of their being. And I think that's what makes the wellness piece stick. And if we move our bodies 10 minutes a day, our mood will be boosted for hours. So it's a very small thing that can reap great reward.
Is this one of the things that you would say actually helps when you talk to a patient and you're trying to get into this whole being aspect? Because you and I had a conversation backstage, and we were talking about the medicine kind of compartmentalizes, like I need to go see the heart doctor, the liver doctor, the kidney doctor. And really when we're talking about our mental health, it's full body. It's a
Yes.
whole being approach. And I think that's one of the aspects, being longevity and all of us having several years in practice, which I think is amazing because I look at both of you and I'm like, wow.
And we look
at
so
us.
good for our
That's right.
ages. Yes.
But we feel even better than we look.
That's right. That's right.
So how would you say, as we get that functional medicine and mental health perspective, how do you see when a patient comes in kind of encompassing them in a whole being approach rather than you're here for your brain
Yes.
kind of thought process?
So my approach, I think, is probably different than what someone expects when they're coming in for the first time for a psychological evaluation. But I ask them about their sleep, what they're eating, how many times a day do they eat, how do they move their body, what is their spiritual practice, and I think many of them are surprised. But one of my cornerstone messages to them is that whether it's depression, anxiety, there's no cure per se, right? We just learn how to minimize the symptoms and manage.
Well said.
And I will tell anyone that sits in front of me on my couch that you will never take control of your anxiety if you do not move your body. And my counsel to them is 30 minutes a day when they have intense anxiety, because it's all about managing. There's not a cure. We're human. We are going to have emotions. We are going to have reactions to situations, but they can be mitigated if we have healthy practices.
And I love the fact that so much today we're seeing a personalized healthcare, meaning not trying to take care of everybody with similar symptoms the same way, but really try to understand how to get there, what is their daily routine like, what kind of stressors are they really going through in life, because I don't know anybody that goes through the same thing. You can't say everybody that lives in this town has the same issues, everybody that makes X amount of money has the same issues. Everybody's unique.
Yes.
And I think that that's one of the things that I've commend in you and your work is the fact you've been able to have effectiveness in areas that other people have not, because you include an integrative approach into how to help that patient.
And I also I always tell my clients, my heart is bigger than my ego. So I'm not ego driven where I feel you've come to me, I'm going to take care of everything. No, I refer to chiropractors, I refer to nutritionists, I refer to functional and integrative medicine practitioners, especially with women who are dealing with menopause and are feeling dismissed by their OBGYNs. So I know that it takes a community to make someone the best version of themselves, that it's not a one-stop shop, it's a collection, just like our habits.
It is a beautiful thing to hear you say, back to the comment of there is no cure, it's being able to learn how to deal with it. And I think many people out there that are suffering today really are doing themselves great benefit if they see the same opportunity that you is. Let's get a team together, let's have a whole being approach, and let's build on that kind of opportunistic momentum. If we're talking about movement, we should be moving the nation towards being able to combine ourselves as a whole being care provider, and that's a beautiful thing.
That's right. And I appreciate the two of you.
Thank you.
Thank you.
Yes.
Time, talent, and wisdom right here. Well, I want to thank you for joining us. Whether you're tuning in virtually or you're here in person, we want to thank you for watching. We're so excited to provide, drumroll please, Fab, an update for you. We just started, and we've already raised $780.
Yeah, but also remember that our weekend goal is to raise $75,000. So we still have a long way to go to reach our goal, but every dollar counts. And remember, these dollars that your patients find a doctor of chiropractic, that's where we're going. We're trying to bring the awareness of your value, our value. And we want you to make sure that you are part of this. And please take the time to let people know that we're having this virtual event, and we created it virtual so if you couldn't be with us face to face, we want you to tune in because there's so much information, just like you heard Dr. Tara. You know, we need to understand that in chiropractic, we're dealing with not just the physical body, we're dealing with a mental body at the same time, and how we bridge that together and collaborate with doctors like Dr. Tara, that's what's going to make all the difference in the way that we can support the health of our community. So we're going to take a break right now, and we'll be right back.